we'll make sure you get credit for attending today. Go ahead, Martine. I didn't know, are you going to share your screen too?
Yes.
Okay,
Yeah.
perfect.
Can you guys hear me okay?
Yes.
Okay, perfect.
Yeah, you might talk a little bit louder, maybe.
Okay. Then, okay.
Thank you for being patient with us today. We really appreciate it.
Okay, what screen are you guys seeing?
We're seeing you have like your first screen and then the next one. So
okay, so I'm trying to.
If go down and push the one right next to the. Oh, you had it. It's the one right next to the plus minus thing.
Where at?
It's at the very bottom. You say it says 100%. Yeah, push the one right, the next one over right there. Push that one.
Okay. All right. Are you guys just seeing the screen?
It's still showing that.
Martine, unmute or you can leave it in presentation mode. Just unshare your screen, and then when you go to share your screen, it'll show you a couple options of which screen to show. So you want to show the one where it's taking up the entire picture. I don't know if that made sense.
It does. Sorry for all the technical difficulties.
It's just been one of those days.
So right now we're seeing the Zoom browser.
Okay, what about now?
There we go.
Okay, perfect.
We got it.
All right. Nice. Thank you, guys. Welcome, everybody, to today's Learning Collaborative. The topic is going to be the role of peer supports in providing care. If you guys haven't done so already, please go ahead and type in your name and organization into the chat box. That helps us with attendance and keeping track on who's attending. Sometimes it helps if we are not presenting, if we turn off our cameras. For those people that are more in the rural areas, the broadband is not that great. So when we all have our cameras on, it's a little bit difficult for them to listen and view the presentation. So if you guys can do that, that would be great. And then we'll go ahead and get started. So today's presentation is being presented by Sam, the Director of Practice Transformation, which she will be joining us here in just a couple more minutes. She's running a little bit late. Diane?
And then I'm Diane Halo. I'm the program manager, the program director here at Greater Columbia. I am not going to be doing much for this presentation, Martine, and has been really working hard on this. So we really appreciate him and all his work on this.
Okay, thank you. My name is Martin Sanchez. I'm the Senior Practice Transformation Navigator for Greater Columbia. And I am the boots on the ground meeting with all of our contracted practice transformation sites. So you guys should be familiar with my face. So today's agenda, we're gonna be doing a presentation, just a few slides on some information on peer supports, what they are, what they can do, how to become one, the steps for that. Then we also have some presenters today. We have Triumph Treatment Services, we have Palouse River Counseling, and we have our one of our board members, Ronnie Batchelor, presenting on peer supports. And then there'll be some time for questions, and then any closing discussions as well. We'll announce at the end here of the presentation. So today, I just wanted to start with kind of a slide of the history of peer supports in the state of Washington. And I do want to say just before we dive into this topic, I'm not an expert on peer supports by any means. That's why we asked the three presenters today to present on peer supports. They're more involved in that world. So they are going to be presenting a lot more information than I am today. So I just wanted to let you guys know that I'm not an expert on this topic, but it is an interesting topic that we are you guys, our audience, wanted to hear more about peer supports. This topic came to be from a survey that we conducted last year on what topics you guys wanted to learn more about in 2022, and this was one of the topics on peer supports. So the history of peer supports in Washington State. Washington State started offering peer support counseling, and starting in 2005. It was one of the first 11 states to deliver peer services using Medicaid funding. Initially, peer supports were only authorized for mental health care only. So they were the only organizations that were able to utilize peer supports. Then later down the road, in July 1st of 2019, there was expansion of peer support services that was allowed. And this allowed the use of peer supports as a Medicaid benefit for SUD providers as well. Currently, behavioral health and SUD providers are mainly the ones using peer supports. There are other care settings where they can be used, but mainly they are used in behavioral health and substance use provider organizations. Behavioral health and SUD providers, in order to be able to utilize peer supports, they need to contract with the managed care organizations. So one of the MCOs for the Greater Columbia region, those are AmeriGroup, Coordinated Care, Community Health Plan of Central Washington, and Molina. So those are the four managed care organizations, Medicaid providers that are in the Greater Columbia region. So if your organization, wants to be able to offer this service and be able to bill for it, because this is a billable service using peer supports, you guys would need to work that into the contract of your managed care organization. So each one of those, depending on how you're going to be billing on the insurance, depends on the insurance of the patient as well. So making sure that this is taken into consideration when negotiating contracts, when internally, when you guys are saying, hey, let's implement peer supports within our organization. This is one of the steps that will need to be taken in order to be able to be reimbursed through Medicaid for using peer support services. And then also they'll need to, it's either the MCOs, managed behavioral health organizations, the BHOs, or Behavioral Health Administrative Service Organizations, so the BHASO. So those are the three organizations where you guys might need to contact and have conversations with about peer supports and being able to bill for those services. Peer services explained. When we hear peer services, I myself was not very familiar with peer services when I first started working for Greater Columbia. When I started working with behavioral health, substance use providers, that really opened my eyes to a little bit more what peer supports are and what they can do. And as we have worked, as I have worked over the years with the different organizations, I have learned a little bit more. But like I said, by any means, I'm not an expert. So peer support services explained. This will give you guys a little bit more information on what peer supports are able to do. So they are individuals going through behavioral health or substance use services are paired with trained peer support counselors who share similar life experiences. So and then making those identifications within each of your behavioral health or SED organizations on, kind of identifying those individuals that would benefit from having a peer support counselor provide services to them. They share life experiences, they share maybe similar problems, similar issues, that they're able to help those individuals as they're going through their programs. Peer supports can also work with adults. They can work with youth and the parents of children receiving behavioral health services. In one of the presentations from Polluster Counseling, you guys will hear more a little bit on how they're using peer supports within their WISE program. So the WISE program is for youth and their parents. So you guys will hear a little bit more in that sense from Polluster Counseling here in just a couple of minutes. And peer supports assist individuals and families in developing their own recovery goals. So there is a lot of self-management support that is provided through peer supports. If you guys are familiar with the Greater Columbia CARES model, one of the milestones within the toolkit is specifically on self-management support. So this is hitting into that milestone of providing self-management support for individuals that are going through recovery. And they're able to help them develop goals that they will, accomplish when they're at home, when they're not in services. So this is, really putting the voice of the patient into the care that they're receiving. So coming up with their own goals, which we know that if they have a voice in their care, they're more apt to reach those goals because they're the ones setting it, and it's not somebody else telling them what to do. Peer supports are also able to provide individual or group support in various settings, such as behavioral health agencies, substance use disorder treatment programs, hospital and crisis teams. So earlier I mentioned that behavioral health and substance use disorder treatment programs are the ones that use peer supports the most, but they can also be used in hospitals, and they can be part of crisis teams. But just a little note on having peer supports be part of the crisis teams. They need to be, kind of not a special person, but have, somebody that is not going to be, something is gonna that they're out in the field for a crisis call. That's something that's gonna bring back something that's gonna make them relapse, or that's gonna make them, kind of go into depression. So kind of using peer supports in crisis teams, just knowing that peer supports, kind of have to have that shared life experience, that it might trigger something that, kind of set them back. So just a little bit of kind of caution around using peer supports around crisis teams. More on peer supports. Peer supports are able to provide services under the consultation, facilitation, or supervision of a chemical dependency professional or mental health professional who understands rehabilitation and recovery. That is key to make sure that there is oversight of them, to make sure that they are providing the correct services, they're guiding the patient into the right path, and making sure that, having the peer support be part of the care team of the patient is very important as well. The peer support can have valuable information that the patient might not be sharing with their clinician. That's by having the peer support be part of the care group, they're able to pass along that information. A lot of times the peer supports, they don't see them. They don't see the clients in the clinical setting. They see them out in their homes. They see them, out on the streets. They see them out in the parks. So there's, different settings where they see them. And that can be valuable information for the clinicians, making sure that they have a whole picture of the patient's, kind of environment. So looking into social determinants of health, are there any specific social determinants of health that are impacting the care that, the mental health or SUD provider are providing, that it's making the patient not, move forward with their services that they're being provided to them. One, it might be that they're homeless and that they're not sharing with their clinician. Maybe the patient is not really worried about the treatment he's receiving because he doesn't have a roof over his head. So, peer supports, having them be part of the care team is very valuable, just because they can have additional information, that the patients might not necessarily share with the clinicians. Peer supports also provide scheduled activities that promote recovery, self-advocacy, development of natural supports, and maintenance of community living skills. So going back to the self-management, it's not just setting goals for the patients, but it's kind of teaching them, when you come up on a situation where there's drugs around you, what do you do? So the peer supports are able to kind of walk their patient through the different scenarios, and hey, these are some tools, or these are some things that you can do to kind of get away from that and not have you relapse. Or kind of hey, if you need access to a computer, this is how you can access it to create a resume. Or if you need housing, this is where you can go. So peer supports are very important in providing resources to the patients as well. And peer supports can also support services are documented in individual service plans. So going back to having them be part of the care team, sharing the information that they know and adding that into the care plan is very important, just because it creates a better path for the patients to be able to recover from the conditions that they're suffering from. So if there are any individuals, out in the community, people that you guys are working with that might want to be, kind of become peer supports, here are some steps on how to become a certified peer support counselor. So in order to, for an agency to have peer supports, they need to be certified. And these are the steps that someone can take to be a certified peer counselor. So they'll need to complete online prerequisite courses and send a copy of the certification of completion to the healthcare authority, and that's the email that it would be sent to. They would need to complete the peer counselor application, be accepted for and successfully complete the healthcare authority approved certified peer counselor training, and take and pass the state certified peer counselor oral and written exams, and become credentialed as an agency affiliated counselor or other counselor credentialed through Department of Health. And then here is another link for more detailed information on the certification process and training that will give you guys all some information that you guys will need as well. If you guys want to implement peer supports within your organizations, these are some ways that you guys can do it. First is providing technical assistance, training, and toolkits are available for those interested in adding peer support services. So they're out on the internet. They're funded through substance abuse block grants, and it's offered at no cost to agencies. So block grants, I know some of the agencies that we work with have those block grants. Topics include for operationalizing peer supports can include peer services implementation, hiring practices, supervision, or documentation. And for more information, this link, the peerworkforcealliance.org, gives you guys a whole lot more information on how to implement peer supports within your organizations. This video here, I always like to have a video with the presentations, just because they kind of bring a different sense into the presentations. There's not just somebody telling you guys, hey, this information and this and that. This is actually somebody that went through the recovery process by using peer support. So we'll hear their stories, and then we'll continue from there. Can you guys hear it? Okay.
Yes.
Okay, perfect.
I ended up at GBMC July 6th of last year. I was picked up by a random pedestrian on the side of the street by the convention center in downtown Baltimore. I ended up here because I had endocarditis and a bad blood infection. That lady saved my life.
We have an SBIRT program here at GBMC. The SBIRT program stands for Screening, Brief Intervention, Referral to Treatment. It's a screening built into EPIC that the patients have a series of questions that they answer through a nursing screening. And then they calculate a score based on that screening. And if they screen positive, they are flagged for one of our peer recovery coaches to see.
When we become aware that a patient meets the criteria for one of us to come in and speak to them, we go in with the approach of just learning what their history has been. What's been your background? What do you think what the behaviors that you're practicing affected your life in any kind of way that you might want help in changing?
When we adopted our SBIRT Peer Recovery Coach program, we decided to leverage the EPIC system to really make this work and automate it and make it a reliable system. So through that, we've created the peer recovery screens where our triage nurses will screen patients 18 and over who come in. The physicians and advanced practitioners have the ability to find out what the screening showed and see if somebody screened positive.
We'll set them up with any kind of treatment that they are willing to accept, whether that's inpatient or outpatient, and then we refer them to our outpatient coach, who will then see them in the community and follow up with them and make sure they're going to their meetings, make sure they're following along with the recovery treatment, and give them any kind of resources they may need later down the road.
How have you been since the last time we met?
Fantastic.
So I became aware of the SBIRT program at GBMC through my colleagues in the emergency department, and I was very excited about it, mainly because not only is the resource available for patients who are coming into the emergency department, but for patients that are sick enough to come in the hospital, many of them also have substance abuse issues. And so the SBIRT program follows the patient beyond the emergency department into the hospital.
It's just become an amazing experience. And every day. When I first got here, I didn't deny opioid addiction. I mean, it was clear to everyone that saw me that I was in a bad way. I was homeless, on the street, and I gave up on life. I was put in contact with the peer recovery specialist, and the guy in particular that I dealt with was fantastic and spent more time with me than he probably was supposed to. But that program provided me an avenue for someone that actually understood some of the things that I'm going through, because the doctor understands the clinical part of what was going on with me, and they understand addiction from a clinical standpoint. But when you're talking to someone that has been through it, you have a little different understanding than someone that sees it from an outside perspective.
The smile on your face, the energy that you bring, it's totally different. It's miraculous.
Absolutely.
Sorry. Not sure what happened there.
Huge win for everyone involved.
Whether you're talking opioids, you're talking alcohol, you're talking cocaine, we can save people's lives, we can save people's families, and ultimately save the healthcare system trillions of dollars. The costs to the healthcare system for substance abuse, whether it's the medical complications of IV opioid use or the medical complications of long-standing alcohol, is tremendous. And this is an area that I'm so proud that our state has been addressing, and I'm incredibly proud that our hospital has been addressing.
Well, I'm a person in long-term recovery myself, and so it created an opportunity for me to help other individuals. It's almost like service work, but just on a different level where we're directly seeing patients and just being supportive to them, to their process of hopefully getting into recovery.
Now things are fantastic. I just got married. I'm employed as a subcontractor, and I couldn't have a better life. But that all started here a year ago. It's been amazing.
This is just one story from many that are out there on the successes that peer supports have on individuals that they work with. One of our presenters, our board member Ronnie, will share her story here in just a few minutes, from kind of what led her to become a peer support to, now that she has been a peer support for many years, what her experience has been with that. So I'm really excited to have you guys listen to the guest speakers that we have today. I really want to put the time, give the time to them to be able to have them present, feel no rush, have time to ask them questions if you guys have any questions. So feel free to, at the end of the presentation, we'll have a few minutes for questions. So feel free to jot down your questions in case you say, hey, I might forget it. Feel free to write it down, and then that way you can ask it as well, or you can type it into the chat room. We'll keep an eye on the chat room as well. And you guys can type in your questions on there as well. The first speakers that we have today, we have Teresa Atkinson. She is the Vice President of Substance Use Disorder Services for Triumph Treatment Services. Their organization is one of the sites going through practice transformation. They are in cohort 2. They are currently in their 3rd year. And Teresa has been a huge champion of practice transformation within Triumph. Her and her staff have done a really wonderful job. And I wanted to give them this time to, one, highlight Triumph Treatment Services, and then also give them the time to highlight the programs that they use peer supports for. So Teresa, go ahead and take it away.
Great, thanks, Martine. Hi, everybody. I'm Teresa, like Martine said, and we came here today to talk about our peer support program. We're super excited about it. Peer supports for us kind of started about a year ago. We were able to hear about a grant through the Department of Commerce, and one thing led to another. So I'm going to take you a little bit about on the journey to actually starting peer supports, and then I'm going to speak. Virginia Sanchez is our clinical supervisor, but she had to be out today. So I'm going to take on her part of this presentation and tell you about what it's been like since being the supervisor of peer supports. And then we have Liz Wangler, who is going to share what it's been like to be a peer support for Triumph. So with that, I see my presentation up there, and I think there's a little bit of time at the end for questions. And I also have 2 full slides of just research that we did on peer supports as we were developing the program. So I'm sure these slides will be made available for other people if you want to gather that material and use that to start your own program. So we think peer supports are super important. Yes, thank you for sliding through there. All right. Like Martine already talked about, peer supports are people who have lived experience. They serve as like mentors and coaches in the community and really offer hope and inspiration as people begin their journey to recovery. What I really like about peer supports is this, it's such a grassroots level of activism within the community. I'm also a person in recovery who got into recovery through a 12-step model program and with the help of a sponsor and with a community. And so I personally know how important it is for us to have community in recovery and really have people that we can turn to who have walked the path before us. I sponsor women today. I still have a sponsor. And I just think that that's been a huge part of what I've been able to do with my life and the changes that I've been able to make in recovery. It speaks to the self-management piece that Martine was talking about. It speaks to that patient-centered, strengths-based sort of perspective. So I love everything that is about this. And I completely think that I would have been a peer support had that been an opportunity for me when I was getting into the field. But this is, like you said, it's relatively new. So next slide, please. Thank you. I started to talk about this briefly. Go ahead and click the first one, please, Martine. Thank you. There was a grant that came through. It was a COVID-19 relief grant around program expansion and program development. We applied for the grant specifically to start peer supports. So we developed some policies and procedures, and we learned a whole bunch of stuff about it, and we applied for this grant. And what the grant did was it funds us to have 3 peer supports on staff for, I think it was like a 22-month grant. So it'll take us into next spring, and allowed us the opportunity to really develop the program and start doing it and build it prior to actually needing a whole bunch of money to keep it going. We have time to make it self-sustaining. So that's been just a huge blessing. The next one, we also got some funding through GCACH around their community health worker program. So when I heard about the community health worker, I was looking at the definitions of what's community health worker, and I'm comparing that to peer supports. And what I saw was not a whole lot of difference. So I talked to Greater Columbia about, like, these kind of look like the same things. What do you guys think? And they're like, yeah, like, that's, go ahead. So that's what we've done. And Liz is actually, her position is funded by that grant that we got for the community health worker grant through GCACH. So she's been able to kind of take it in a different direction than the peer supports, because there's so much about the community education and that health worker piece around reaching other people, the outreach and the collaboration. So we tweaked it just a little bit for what she's doing, but it really, the essence of it is pretty much the same. And then the last one there, obviously we're going to bill for our services. So I'm going to speak to that a little bit more in the next section, but basically we can bill, like Martine was saying, the HCA or the MCOs for case management type of units with the peer supports. They do have to be connected with us through the SUD services. And we are actually, you can go to the next slide there, thank you. We actually are applying for a mental health peer support amendment to our license at this point now too. So we started with the SUD peer supports amendment. We got that approved through the Department of Health. And now we have Leah Batty-Hibbs, who's our VP of Mental Health Services, and we're going to do peer support specifically for mental health. And I'm assuming we'll be able to have people who can do both and either, which is going to be fantastic. So I added the link here to this slide if you want to look where that application is through the Department of Health to amend your behavioral health license. It's pretty easy to do if you already have a behavioral health license, which many of us do here already. And then I think Martine had the same link on one of his slides, but this is the tool, the HCA toolbox sort of thing for the peer supports on their website, which was just full of just tons. The HCA has great toolkits. They have tons of information on there. They're super responsive. Like, I would just call people up and we would set up meetings and they would just let me pick their brain for hours on end about, like, how are we going to do this? And what does this look like? And how is that different than this over here? And just super, super, super helpful. And there's tons of research. So like I said, the last 2 slides of this presentation is like a reference page of all the research that we were able to find. Peer supports has actually been around for long enough for people to have really studied it. And it's super effective, and they have proven that it's effective. It's a great way to reach people. There's so much to be said about self-management and the way that we utilize community supports and the way that we can impact people by coming to them at this level, as opposed to that clinical kind of top-down approach that we've traditionally met people at. So next slide, thank you. Okay, so this is where Virginia came in. So if it looks like I'm reading stuff, it's because she sent me some notes and I just don't want to miss anything. All right, so currently we have 26 people enrolled in the peer support program. That number's gone up significantly since the beginning of the program. We've continued to work and have new peer supports. We are increasing the numbers of the peers we're working with. Since we started meeting with peers last September, we have also had 43 others who were enrolled in services and 46 who are not enrolled with services, but we were able to get some supports there. And what we're talking about there is, when we hired Liz to be a peer support, her and I actually went through that certified peer counselor training together. I think we did the videos together, got that pre-certification, or she did that one on her own. And then we applied, and then we went through the 2-week training together. So it's like, usually it's 1 week, 40 hours in person, but because of COVID, they're doing half days for 2 weeks. And then you immediately follow that with that verbal and written test. And then they let you know about 2 to 3 weeks later whether or not you've passed. For me, I'm already an SUDP, so I didn't apply for an agency affiliated counselor license. I just tacked on that certification to an existing license. Liz applied for the agency affiliated counselor license, so she has that for billing. We hired a couple more people after that, but we're basically, because we have the grants, we're able to support our new staff in getting certified while we're working with them, as opposed to requiring that certification up front like we do for other licensed positions. So that's just been incredibly useful because there's just not a lot of people who have that certification right now. There's a ton of interest. We've had like no problem finding people who want to do this work, who have that lived experience and are interested in supporting other people through this. What we've done though to kind of build that up is that we've collaborated with people. We've done a lot of outreach. We've also been able to have peer support folks who are coming into our inpatient programs. So when they call and they get that bed date, it might be 3 days, a week, 2 weeks until their bed date. Well, the peer supports will start calling them with their permission and checking in with them daily and just saying like, hey, is there anything I can do? Can I answer any questions? And that additional like interim services type of support that we're able to offer has really been super helpful for folks who are nervous about coming into inpatient treatment, helping them keep that contact so that they actually make it to their bed date. And we get a ton of positive feedback from the people that we help as they're waiting to get into inpatient services. It really builds that connection and is setting them up for some long-term success within our inpatient programs. We do a lot of outreach. Our peer supports are kind of our main source of outreach now for Triumph. They go and they talk to folks at Camp Hope, Yakima Neighborhood Health, OIC. You know, they're doing stuff where they're just going and meeting people on the street and talking to them and telling them about our services. Sorry, I'm not even paying attention to the PowerPoint anymore to see where we're at. Go ahead and move to the next one. Sorry. Yep, go ahead. You can click through those. I've talked about that one. Outreach, got it. Next. Okay, now I'm all caught up. Thanks, Martine. All right. We are helping with stuff like resource fairs, health fairs, drug take back day. I think that's coming up this weekend. Going out into the community and just telling them about our services. And then as far as the unbillable service, so our patients have to be outpatient, or the people who work with the peer supports, we don't call them patients in that program, we call them peers. So peers who are working with peer supports have to also be enrolled in Triumph services as far as our outpatient substance use disorder treatment program. So the peer supports is a billable activity that's enhanced on the treatment program, which is great. There's a lot of people that don't fall into that qualifier. And because we don't have full caseloads yet as we work to build the program from scratch, we've been helping people like basically wherever we can. So if we have a patient on our Pregnant and Parenting Women long-term campus who is local and she's going to be going into our outpatient services, like we'll start helping her way early on in the process while she's at the PPW campus. And then we can keep walking with her after she comes into outpatient. And that really helps that transition from residential to outpatient and all of the pitfalls that a lot of us go through in that transition. But we can't bill for that. We're just walking it out, and we're working on just kind of building the brand and helping people recognize that we have these services and putting ourselves out there, and just building up that reputation of how useful this is for people. And as they find it useful, hopefully they are spreading the word and telling other people about it. There's just so much to be said about the level of support and encouragement that the peers are able to offer to the people that they're serving. We've also been able to, the food and clothing pantry. We've been able to do this really cool thing where we have this kind of like wasted space little hallway that goes nowhere in our peer support building. And so they're going to build like shelves, and we've started collecting like food and clothing and, you know, necessities. And then that way, when people drop in for their peer supports, if they have a need, we want to just be able to meet that need. for anybody who comes by. It's kind of inspired by Rod's House. For those of you who know that incredible program here in Yakima for youth, they have this drop-in house and people can come by and they can get a backpack full of stuff. They can get a hot meal. They can get some food to take with them, pair of socks, like whatever they need. We really want to kind of build that sort of environment in our peer support office and just be the kind of place where people can just go and get help. Like, what does that help look like? We'll help you figure that out too. Let's see what's on the next slide. I'm as surprised as you guys about this. Oh yes. These are 3 of our 4 peer supports, Oswaldo, Kristen, and Sherman. Oswaldo and Sherman are our newer folks. Kristen went through all the training, and instead of getting her agency affiliated counselor, she actually got her SUDPT, but she doesn't want to be a counselor yet. She wants to be a peer support. So we're accommodating her because she's amazing. Like I was telling you before, we do the on-the-job training, and we're really, really supportive of what are your long-term goals. Triumph just wants to be the kind of employer that helps move people towards those long-term goals, whatever those may be. So, and then the 4th one, go ahead to the next slide, is Liz. So at this point, I'm going to let Liz tell you what it's like for her to be a certified peer counselor and our community health worker. And I believe she is on here. She's going to turn on her camera and she's going to do her part of this presentation.
Hi, I'm Liz. So I think that being a peer support, I think the biggest thing for me and my team is being able to make that connection with our peers and letting them know that they're not alone. Because anybody that we work with has a substance use disorder, and that's connection is one of the first things that we lose when we're in our addiction. And so it means a lot to be able to build that with people. While we are working with people, we are able to flex our schedule. So we don't necessarily work the 8 to 5. Like right now I have a peer who wants to go to an AA meeting that is Tuesdays at 6:30. So I flex my schedule to be able to accommodate what she would like to do. And I have a few peers who do that as well. And we get to meet them where they are. So they don't have to come into the office. We have some peers that like to meet for coffee. We take our laptop to the park. We do our individual service plans wherever they are. I have a gal who has 2 young children, and for her to come into the office, that's pretty hard. So I just go to her house. The peers get to choose really what it is that we work on. So it can be something as little as reading to their kids every night, getting a food box, taking the steps to get their license. Right now we are working with quite a few peers in transportation. So when they get out of campus, a lot of the gals aren't from this area. So riding the bus is new to them and they don't know the area. So Kristen or I will ride the bus with them until they're comfortable riding the bus by themselves, or they're comfortable knowing the route. Let me see, we help people get their, apply for their financial aid. Sorry, I have a cheat sheet right here because I get nervous. I just think that it's really rewarding. When we first start to meet with our peers, we are focused mainly on like barriers, like what is in your way, preventing you from doing what you want to do in recovery and in life. And when we start to knock down those barriers, it's very rewarding when they start to call you just because they're having a good day or because something good happened. So after you build that connection, I just feel like it makes it easier for the peers to come forward with whatever is going on in their life. I have a gal that I've worked with since before she got clean, and she has some time under her belt, but now she gets to bring her children into the program as well. And we get to connect them with other peer supports in the office. Because she has made that connection with me, she wants that for her children. And I just think that that's really rewarding. That's all I have.
Slide please. All right, so thank you, everybody. I think there's another picture if you click on that. No?
Nope.
Oh, there's the references. Okay, so did you want to take questions now, Martine, if they have any?
Let's
You wanna
wait.
till the end?
Well, actually, let's take questions for you because I know you have to go, Teresa. So if there are any questions for Teresa or for Liz, please feel free to ask them, type them into the chat box. She does have a visit from the Department of Health, so she does have to go here in just a few minutes. But while people are thinking of questions, maybe typing them into the chat box, I want to thank you, Teresa and Liz, as well. Very informative. Liz, your stories is just they just show the importance of peer supports, having them out in the community. And we can tell that you're very passionate, you're awesome at your job. So thank you for doing that to the community members in Yakima and around the Yakima area, and for talking today. So it looks like there's no questions in the chat box. Diane has a question. Go ahead, Diane.
I just wanted to make a comment that, Liz is one of the community health workers that is part of the Greater Columbia's community health worker program that we have just started. And I love to see the peer support and the community health worker as one. I think it's amazing. I think that I'm really impressed with your program, and I'm very thankful that you're able to come and talk about it with us today. Thank you so much.
Thank you, Dan.
I
Melissa, did you have a question?
I do have a question. I really love the program. Sounds fabulous. I'm used to, I know as mental health, often case managers and peers and stuff go to people's homes and transport clients and do lots of different things. And in the SUD, that's not as common in my experience. So it struck me as the peer support counselor was talking about that she does go to the peer's home. So do your peers just go to these homes just by themselves? Do they go in teams? Is this a common practice on the SUD side with peers? Because this is the first I've heard of it on the SUD side. So
that's a great question, Melissa. Thank you. We have the PCAP program for Yakima County as well. And we really did had a lot of job shadow with PCAP who for that reason, right? They already have so much experience doing this in-home community-based advocacy work. So being able to utilize them to help show our peer supports how to navigate something that can be relatively tricky and at times maybe unsafe even. How do you navigate that with healthy boundaries? How do you navigate that and keep your own recovery solid? How do you navigate that and know how to get yourself out of sticky situations should you come across that? So we've just had the benefit of 30 years of experience doing PCAP and allowed that program to show the peer supports how that can be done in a way that's safe. Because I think it's important that we do meet the peers exactly where they are and help them get where they're trying to go in a way that's not going to put ourselves at risk and our staff at risk. To be clear, we have a fleet of vehicles at Triumph, much like Merit does. So being able to do that, we don't drive peers in our own cars. We use agency vehicles and the agency insurance to kind of cover on that front.
Okay. So but your peers do it just one-on-one, right? There's not like two peers per if you're transporting someone or going to a home. It's just peer to peer, just like the Triumph peer and the.
Yeah, I mean, I think Liz could probably answer this better than me. There have been situations like when we're picking up somebody, we sometimes will pick up patients on their way to inpatient treatment, right? In a situation like that, Liz, correct me if I'm wrong, but I believe they go in pairs on a situation like that because the person may or may not be abstinent from substances. They may or may not be stable at that point. And so what we do is we'll go like Oswaldo and Sherman will go pick up a gentleman and take him to JOTC. Is that right, Liz?
Yeah.
Yeah,
Okay, thank you.
definitely. And we can do telehealth as well. So, you know, maybe that first meeting, what we're doing is meeting with them telehealth if they can't come into the office. And then from there, after we've developed some rapport and we have some better idea about their situation, then we can make different choices about the safety in the situation. It's a good question, though.
That is a great question. That, you know, I think that is key to, you know, like community health workers and peer supports is that, you know, is meeting those patients where they're at. But I think originally you really need to assess the situation first, I think, before you know, put yourself in a situation that would be unsafe or, but you know, that's a good thing about telehealth too. I mean, that really has improved that as well. Good job.
Thank you. Yeah, we definitely, you know, the 12-step program talks a lot about how to go about doing a 12-step call. And so being able to, we can model, we don't have to relearn from scratch. There's a lot of programs out there that have been doing work like this. And whether that's AA, NA, or PCAP, we can learn from what they've done. It's great.
Great. Thank you, Teresa. Are there any other burning questions from the audience out there that you guys want to ask Teresa or Liz before they take off?
Thanks so much for the opportunity, and my contact information is on 2 slides ago, so feel free to let me know if you do have any questions. I'm happy to help.
Thank you, Teresa. Thank you, Liz. All right, perfect. All right, so next we're going to be hearing from Palouse River Counseling. We have Christine Hicks. She is the WISE care coordinator there at Palouse River Counseling. So go ahead and take it away, Christine.
Hi, thank you. And I also have Leslie Cornejo, my